And we're live. Here we go. TikTok live number 51. We're up to 51 already. That's crazy. It's Tuesday night right now. Just did my second tracheostomy today. Within 5 days, I've done 2 tracheostomies, my first 2, which is crazy. And as an oral surgeon, a dentist, it's wild. It's awesome. It's pretty cool to do that. You could save lives by, they're choking on something. You do a trach or crike and you save their life. Yeah. So top 5 listeners to this episode. I'll be on for a little bit. I'll be giving you guys a shout out in the caption of the podcast. I'll be posting to podcast, Spotify, Apple, and YouTube. All right, guys, let's get to it. So the first person ask a question was Rai B. Why so late today? Don't you have to wake up early tomorrow? That is true. Gotta get up early every day. I was up really early today. Really early. Earlier today. I had to do my morning workout later on. But yeah, tonight I got 2 beers with guys in the program after work and just able to talk out some stuff, talk out some issues, some I don't know, not necessarily problems, just some things on our mind. And it's good to unwind over a couple beers with the guys at the end of the day once in a while. And we hadn't done that in like 2 weeks. So that was really big to be able to do that. And then after I got home at 9 o'clock, I had a meeting with our website team. We had a meeting with our website team, the Pre-Dent Mentor Map. If you're a pre-dental student applying to dental school, you're interested in getting some like ideas or getting some questions answered to each dental school, we have the match stats going up now. It got a lot of feedback from current dental students. So thank you guys. If you've helped me personally and our team with Students of Dentistry, Sean, get these match stats from this year. Match stats are stats of dental students that have matched into a specialty or a residency from dental school. We're putting these like how many students matched into oral surgeries this year? How many students at this dental school in Arizona have matched into orthodontics residency this year, 2025? We're getting these numbers up on the map now. This has never been done before. Doesn't exist out there except for our Pre-Dent Mentor Map. So yeah, guys, Pre-Dent Mentor Map, you could get that information there. It's huge. And this makes the application process a little more transparent, a little less stressful when you're applying. You know what to do. I wish, Sean and I, we wish we had this when we were applying. It's all free, by the way. You don't have to pay for this, right? And we're bringing some other implementations like creating a discount fee for ambassadors to brands and programs and services to get a little exposure there too, and so on and so forth. So yeah, I'm super passionate and excited about this project. If you can't see, we've been working on it for about 7 years now, which is nuts. All right, so and I just got off that meeting at like 7 minutes ago, so that's why I'm coming on late. It's 10 o'clock. But we got to do it, guys. This is TikTok Live number 51. I got to get in one TikTok Live a week because I like touching base with you guys and answering any questions that I can help with. Lexi said hi. What's up, Lexi? How are we doing? JP followed the live Oh, thanks, JP. S. Tips: if you can't freeze a patient for an infected tooth and already given AB 3 to 4 days ago, yeah, that's a problem. When you say AB, you mean antibiotics, I presume. 3 to 4 days ago, that's some time. I would start to wonder, was the patient compliant? Did they take antibiotics for those full 3 to 4 days? Or are they just feeling pressure with the tooth, or is it actually they're feeling pain in that site at that tooth? I would start to question these things, you know what I mean? Because something's off. It's Remy said, that's wild, bro. How'd it go? Yeah, everything went great. Oh, dude. So yeah, the case that we did today was, we started with the trach, but what it was removal of necrotic bone in the maxillary region. And I got to protect some details, for patient protection. Removing hardware plates, screws, and then dead bone of the maxilla, remove that. And what else? Oh, and then coronoidectomies on both sides. The coronoids, we sawed them off too. Awesome. And I'm so fortunate to work with this attending too. He's an absolute legend. Such a nice guy. Great to work with. So full of knowledge about not only head and neck surgery, cancer, oral surgery, but just life. Anyway, let's keep going. Siona said, Owen Hunt. Lexi said, hey, Brendan, can you become an OMFS with a DMD or do you need to be DDS? Yeah, you could do it with DMD. My buddy I'm on service right now, this is the senior resident, Peter. He's a DMD. He's from UPenn. DDS and DMD are essentially the same thing. They say different things like Doctor of Medicine and Dentistry versus Doctorate of Dental Surgery, but it is the same thing. It's the same degree, essentially. Different letters, same degree, essentially. Okay, that's the best way I can summarize it. Harvard tried to branch off in like the late 1800s, if I remember correctly, and created DMD, but most dental schools are generally DDS. All right. O said, what watch you have on today? Oh, this is the Citizen, I think it's like 2100 caliber 2100. It's like some limited edition. I actually inherited this from my uncle. My uncle passed away back like last July last year, unfortunately. One of the smartest guys in our family, really nice guy, engineer, and this I love this watch. It's a great chronograph. I never liked white face watches, but it's got a nice chronograph on it, like timing, and yeah, I love it. It's like one of my desk work days. After I got out of the OR, I came home and I got like 2 hours of desk work in, and so that's when I switched to it. But yeah, I got like a watch with a rubber strap for the OR, and then for OR days or like big surgery days, and then I got this one for more desk work days, admin days, maybe sedations, clinic work days. Yeah, anyway, thanks for asking. Al. User 7356. Have you heard of OMS residents from Louisville want to go there but wondering on residency rate? Yeah, I have heard of residents going there. Yeah. I just met someone that's in Louisville, or two residents that are in Louisville back in the Amos meeting back in October. Gosh, isn't next month 6 months? Can you guys believe that in like 5 days, it's already March? Can you believe we're 3 months into 2025 already? I can't believe that. Wow. And that's like 6 months from the Amos meeting. AT said, check the DM on here. All right. Isaac Kim, follow the live creator. Thanks, Isaac. Mateus Ojeda de Leon. Hi, Mateus here from Chile. Which are topics that you think are interesting to do research in OMS? Sure. Okay, so here's a topic that came up right now. Here's one. I probably shouldn't give this away, but I've been talking about it with Dr. Wiedemann, Thomas Wiedemann at the dental school. There are two things that we know that help with giving patients vitamin D for an extended period of time to elevate their levels of vitamin D, in their blood levels. Prior to doing implant cases, right? Because we're putting an implant in the bone. We want that bone to osseointegrate around that implant and hold it in place, right? We want to heal very good, essentially. The vitamin D levels we've shown, it was that research project that I helped to put together, that I just posted the other day. That's been shown to help with implants. Another thing is melatonin. Now I have to ask my buddy Pat the dentist on Instagram. He's on TikTok too. But he was saying something with melatonin. I don't know if he's putting melatonin in the extraction site after we remove a tooth, putting melatonin in there, or if he's giving patients melatonin. I think he's putting melatonin in the extraction socket. So elevating vitamin D levels of the blood prior to surgery, especially implant surgery, and then putting melatonin into an extraction site, I guess after tooth's removed, you want a bone graft. That's what I would do research on. So just personally, I would look into melatonin. I want to get better data on melatonin in extraction sites. Maybe I'll do it. I don't know. Matthias followed the live creator. Thanks, Matthias. User 7356. What is the app for the match stats? Yeah, match stats. We're adding that now. It's not an app. It's our website. It's called Predent Mentor Map. That's we're adding them right now. We're almost at 10 schools now. Yeah, there's like about 70 or so dental schools in the United States, and we're at about 10. But dude, that's like 1 to 2 weeks. We're at 10 already. So it's we're getting there, It's going to take time. I mean, this whole website's been taking time, but we're doing it for free. We're doing it for you guys. It's going to get better. And, hopefully we can partner with sponsorships with some companies to maybe get some revenue. But the whole point is to create this, to make the application process into dental school and residency a little bit better, a little bit less stressful. You know what I mean? It's for a good cause. I hope you believe in it as we do. Yo, Mammoth, how are you, Owen Hunt? So yeah, user 7356. It's not an app for the match stats, but it's the website. You could look it up, predentmentormap.org. That's going to give you match stats. Again, we only have like 10 schools, but we're adding them. Does mouth tape at night actually have any benefits? Guys, the whole point of mouth tape, at least what I take from it, is when you close your mouth, it keeps your mouth a moist environment. If you're a mouth breather and you're snoring at night, you're breathing through your mouth flora is going to change because you're really aerating it throughout the night, right? It's getting drier and you're getting more oxygen to that area. Versus if you keep your mouth closed at night, so you put tape over it, you're keeping it moist, and now you're giving it more of this is my take on it, more of an anaerobic environment because you're not oxygenating. Your mouth is literally closed, right? You're breathing, but you're not breathing through your mouth at that point. So you're going to change the flora into a different bacteria. Now, is it actually benefiting you? I don't know. Has anyone actually done true research on this? This whole mouth tape thing, I'm not believing it yet. I get it hypothetically, but you're changing it more of a predominantly aerobic versus anaerobic, predominantly bacteria flora, right? That's as far as I can see. I don't know if it's actually changing benefits to your mouth, okay? Just my thoughts. Mickey420, what's your favorite tooth? My favorite tooth? I don't know, maybe the wisdom teeth, because I don't know. Send those wisdom teeth to me, man. I'll take them out. Or maybe the canine, because I like dogs. I don't know. The great kid said, hey, love the podcast and appreciate the advice. Thanks, man. I appreciate you letting me know that. Thanks. That makes me feel good. I'll keep doing it. Frenchie said, what were the requirements to get where you're at, like school-wise? Well, after you finish high school, you got to go to college. College, you need to take the prerequisite courses, like pre-dental courses to get in, organic chemistry, gen chemistry, biology. Some dental schools require biochemistry. Then you also have to take the DAT. That's the dental admissions test. Get into dental school. You have to have good standing dental school, take the CBSC. That's like a medical school board exam, but shortened. You have to get good letters of recommendation, potentially do externships as well. Research is not necessary, but it can add to your application status there. And then you apply to oral surgery residencies. There's 4 or 6 years. They're two different. They're the same residency, but the 6 year has 2 extra years because you're spending that time in medical school getting your MD. There's debate on whether that MD is actually beneficial for being an oral surgeon. Of course, it's great to have that knowledge and stuff, but is it going to increase your salary? No, it's not. Is it going to make you a better surgeon? No, it's not. You're spending time in medical school, not actually doing oral surgery. So you're not doing more different surgeries than a 4-year degree oral surgeon. Just saying this to give you this best insight as possible. All right. Gare said, where do you find resources on how to get into residency programs in dental school? Word of mouth. Sometimes dental schools will give you some paperwork, maybe some stuff, but generally it's like Google. It's like word of mouth through older students in the dental school. Dot said Commando. Yeah, Commando said he's calling it Commando because it's a combined ENT and oral surgery procedure, like I did today, where we resected part of necrotic bone of the maxilla. It was a failed flap previously, squamous cell carcinoma, but dead bone of the maxilla, we resected it, and then they did a radial forearm free flap where they took chunk out of the forearm and put it into the maxilla. Actually, they ended up taking a skin graft from the thigh, putting that to cover up the defect on the arm because donor site morbidity can be very low. Jordan said tonight is about you and me with a. Thanks, Jordan. Yeah. What can I help you with? Dr. Brad Bailey said, Dr. Gallagher, I love you. Brad, what's up, man? I hope you're doing good. Let me know how you're doing. Send me a text. Let me know where you're at right now. C. Benji said, what's up, man? Are you planning on keeping up with the content when you graduate? Absolutely. This is fun. You know, sometimes I enjoy. It's 10, 12 at night, and I'm doing this, right? Like, we're having a good time, and you're on, C. Benji. I see you here like every TikTok live. Thanks, and I appreciate that. I hope you know that. Like, this is like a I don't know. I love this. You know, this is our podcast. This is our time to chat. I don't know. That's how I look at it. And I'm sure you know what I mean, you know. Sunny57 said, you seem like the nicest guy. Best of luck, Doc. Thanks, Sunny. Likewise. I appreciate the kindness. Lily said, it's lagging. Sorry, Lily. Sorry about that. Out Live Health said, what type of watch was it? Oh, it's a Citizen. Sorry, Citizen. I think it's like 8 caliber 2100 or something. It's a chronograph. It's a Eco Drive, so it's solar powered. This thing will keep the greatest time. You'll never have to charge it or like take it into the shop. Yeah, I don't know. I'm a big fan of Citizens and amongst other ones. Tyrese Loves Cat said, are there quote unquote bad OMFS residencies? Yeah, unfortunately, there are quote unquote bad OMFS residencies. What would you define as a bad OMFS residency? I might say, you know, the culture might make a OMFS residency pretty bad because it's not a motivating or encouraging environment for the residents. Another one might be, you know, it might be in a very dangerous area. Yep, that exists. Now that could be good because you get more surgery. Could be bad because you might come out getting hurt. Another OMFS residency, maybe they do a lot of the oral surgery, like head and neck cancer, like too much, like predominantly that, and then you're not getting enough of the taking out teeth, working on big implant cases, working on orthognathics, trauma. You're probably getting trauma if you think about it, if you're at a cancer place. You know, it might not give you the training that you hope to get out of it. You could technically define that as a bad OMFS residency, quote unquote. Roddy said, hey, doc, deciding between UMich and UB for dental, which is better for OMFS chances? I would definitely, guys, you got to go to the Predent Mentor Map. PredentMentorMap.org. We're putting the specialty match rates on there. That being said, I would probably look closer at UMich. UMich has a better track record for placing into specialties. U Buffalo, UB does place into residencies, right? I think UMich has a better track record year after year. Dr. Brad Bailey followed the life creator. Thanks, Brad. Lexi said, I started following a few months ago and your journey has inspired me a lot. Awesome. Well, thanks for letting me know that. And let me know. You said, I'm still deciding between MD and DDS. I'm so conflicted. Here, Lexi, this is what I want you to do. I want you to this summer coming up, or if you have to earlier, do it. I want you to shadow at least one dentist and one doctor in their office, okay? It could be anything, specialty, non-specialty, but spend enough time with them. I would like you to spend at least a week with both of them. If you're confused, this is going to give you a little bit more exposure to both sides, and that's going By the end of seeing both of those, 1 week here, 1 week there, and if you're still confused, see a specialist in those areas, okay? One specialist in dentistry, one special in medicine. You got to reach out. You got to put time into this. Why? Is because it's going to pay dividends when you get a better insight to what you're excited to go into, right? You're by the end of doing that, you're going to realize, like, I'm more excited to go to this office or that office, spend time with this doctor, or, in this office environment doing or seeing these procedures. That's when you're going to know what you want to go into. All right, Lexi, let me know if that helps. All right, couple more guys, then I got to go. Oh my God, wow. I'm way behind. All right, Tyree said, thoughts on UIC and Cook County OMFS residencies. UIC is great. You have my dude, he's got a very, very, like, Dr. Brown. Dr. Brown is at UIC. He's awesome. Cook County, excellent surgical residency. I mean, Cook County's in like the heart of Chicago, where you're getting the craziest trauma in the world. Very busy, very experienced people come out of Cook County. So both of them are excellent programs. Luke, incoming D1, said, loving the updated residency info. Right, Luke? This is huge. Luke said, great seeing it all come together. Yeah, man, and thanks for following along with that, Luke. Dude, we gotta touch base, man. We gotta get on a call. I want to see how I can help you out with your incoming D1 this year. We've been talking for I feel like a year and a half now on these lives, right? Let me know how I can help you with the next step. You're about to start dental school. It's going to change, lifestyle and everything's going to change. But it might get tough at times, and I want you to know, I'm there. Just send me a DM on Instagram. I can help you out with anything that if it comes up, and hopefully it doesn't. KA said, I'm first year in dentistry. What are some advices? What is some advice? Efficiency and effective studying. Effective studying is getting higher scores, obviously, right? But efficient studying is maintaining those high scores and studying for it less and less, needing to study less time, but maintaining those high scores. The way I did that was repetitions using Quizlet cards. Some people use Anki, some people use Quizlet. I was a big Quizlet studier. I would like to put the figures or diagrams or x-rays on the slides, the clinical photos of maybe cancer on the slide. That's how I got my efficient studying down, okay? Efficient and effective studying. Get it. The great kid said, what are your thoughts on Case Western Dental School, good or bad? I don't know enough about Case Western Dental School. I think it's pretty good. Check out what you think on the pre-dent mentor map. On there, we got the stats, the tuition, the average DAT, the class size. That's going to give you a better idea of what you can think on there. And then ask questions. We have a discussion board on there too. If you want to connect with a current dental student there, we have that on there too. Guys, this is all for free. We're making this for you. I think it's awesome. QWordy.1299. Do you think research adds a lot to an application? It can if the interviewer or the dental school or the residency is looking for research, someone that does research and has experience in research. Then it's going to be helpful. You see what I'm saying? But otherwise, it's adjunctive. Make sure you hit the main things: GPA, your grades, your DAT, your CBSE score if you're applying to residency, letters of recommendation, your experience outside of school. Ryan Moon said, hey, man, I like your content. I'm in medical school and interested in cardiology. Any tips? Yeah, cardiology, you got to be ready for a long road. Very long road going through cardiology, and you got to maintain your grades. That's about as much as I know being from the dental side. You know what I mean? Watermelon said, I'm doing jaw surgery for my overbite. Do I have to dissolve my chin filler before? You might. Now, I don't know what jaw surgery you're getting. If it involves a genioplasty, you're most likely going to have to dissolve that chin filler, okay? I would reach out to the surgery that you're getting that jaw surgery with, because they're going to be able to give you that better idea, okay? Does that make sense? Genioplasty is the front. When you basically cut the front of your chin and you move it up, maybe you rotate it, maybe bring it out, maybe bring it down. However, it's pre-planned according to the plan, okay? Jared said, hey, Doc, thoughts on UPenn Dental School and deciding between it and Rutgers. Both of them are great dental schools. I think UPenn has a better match percentage into specialties, however. Now, that doesn't necessarily make it a better school. I would go on the pre-dent mentor map. I would look at the class sizes. Do you want to be in a big class size or a smaller class size? Rutgers versus UPenn, I think UPenn has a much higher tuition. So much to consider. Where's closer to home? Where's further away to home? You know what I mean? There's a lot of things to consider here. Great Design 8 said, what do you think of a GP becoming an exodontist? I love OS so much, but only extractions. I mean, there's a lot of people that do that. It's a common thing in some places. Ro said, hi, Doc. Hey, Ro. Luz Detuvidia, where are you located? Right now in Manhattan, New York. I graduate in 3.5 months from residency, and then I'm going to be moving out to Long Island. My office that I'll be working at is in Melville. It's called All County Oral Surgery. Great Design 8 said, I said that. Colts Blue 5473 said, as a GP, if a patient comes in with a large swelling, is it better to drain through the tooth or puncture it? It really depends. It depends on the location. Do you have nerves in the area? Do you have arteries or veins in the area? It depends on the location. Again, Is it going underneath the mandible? That's going to be very hard to drain from the inside. You could risk injuring the lingual nerve if you go down through that. It could start impinging on the airway if it's under the mandible. If it's buccal, then you should be able to drain it from the inside. But look, this is not medical advice through social media whatsoever. This is just some examples of what you might see in that situation. Okay, Great Design 8 said, I love extracting teeth and I freaking hate endo. I only want to do extractions, fillings, and crowns. LOL. Well, LOL, sure. But you got to do what's right for the patient. Not every tooth needs to be extracted, and sometimes fillings and crowns, as you're kind of mentioning, you got to save teeth too. So that's a tough, you got to think about that. All right, friends, I'm going to be signing off soon. Just a few more questions. I got to get ready for tomorrow. Lexi said, thank you for the advice. I'm graduating college in May, and I want to make a decision soon. Yeah, I hear you. Think about those things. I know you got to make a decision soon. The great kid said, would you make your Quizlet in lecture? I find it wastes time taking notes and making cards later. It could. Do your classes give out the lectures prior, the presentations prior? Because then I would actually make the Quizlet prior, and then during the lecture, you're just adding to the Quizlet, right? You're searching for the right figure to pair with that Quizlet card. That's how you're going to maximize your time. Now, I know it's super ideal to come ready to go to the lecture with those index cards, and it's very hard to do that beforehand. You should be able to do that in undergrad if they give you the presentations beforehand. In dental school, when it's like an average of 32 credits a semester, I found it to be very difficult to come prepared to class with a Quizlet already made. That's very hard to do, and I know that. So just my thoughts. Dro Mandini said, Luca versus Dallas, who you got? Shoot, I wish I could give you that answer. Luca. QWordy said, 1299 said, D2 thinking about going into perio. Any advice for setting myself up for it, and why perio versus OS? Well, when things go wrong in perio, where do they go? They go to the hospital or to an oral surgeon. That's the truth. Think about it. I don't know. User said getting double jaw surgery makes my bite and just really nervous of how I'll look after. Any tips? Yeah, look, you're going to be extremely swollen for quite a significant amount of time, okay? It's not going to happen overnight. You're going to get more swollen over the first few days after your surgery, and then it's slowly, very slowly going to come down over time, okay? Now, I don't know what you're getting in jaw surgery. This is just general insight into how the post-operative recovery time is going to go, but just anticipate that. Expect that. It's going to be a lot of rest. It's going to be a lot of liquid diet for a while. You know what to anticipate, okay? Again, not medical advice. Great Design 8 said, I refer out all my endo, haha. Amro said, hey doc, any idea how hard is the ADAT and how long preparation time needs? I don't know if I took the ADAT, I forget. You're talking about the DAT, which I think it's like the INBDE. That's what they call it now, right? I'm not sure what to give you there. My name, Jeff. I just got into Western Dental School. Congrats, Jeff. Sweet. Excellent. I don't know if we got the specialty match stats yet. That's what we're working on right now with the pre-net mentor map, getting match stats. How many students matched into specialties or residencies this year? We're working on that. I think we have like 10 schools or so. G_111444. Why did you break up with your partner? Well, I'm with my partner right now. I did not break up with anyone. My first year of dental school, this is 8 years ago. Yeah, she broke up with me like 2 months into dental school. Yeah, long distance relationship, and she bailed quickly. What are you going to do? That's life sometimes, right? Sometimes we can't foresee. I did not foresee that. I didn't predict that coming, but it happened, and you just got to move forward. That happens, guys. Unfortunately, the great kid said they do send out PowerPoints early, but leave blank spaces, and then I have to complete exactly what you're saying. It's about efficiency. You got to speed up the process. If that's slowing it down, I don't think it is. I think that speeds it up very minimally, but it does speed it up. I think it's worth it. You think about it. Trial and error will tell you the answer. Awu said, do you think OMFS is great if you possibly want kids in the future and you are a girl? Well, how old are you? Do you have kids yet? Or do you have a partner who's supportive and fits into your timeline with your career and having kids, right? These are all questions you got to answer yourself, right? I think if you answer all those, it'll lead you one way or the other. Make sense? Evan said, why is OMFS taking ENT's cancer cases more and more? It's only certain OMFSs because they went into head and neck oncology, which involves cancer. And then once you go that route, it seems as though a lot of them are unhappy and a lot of them are trapped. Actually, this is very concerning because they're saving people's lives by taking cancer out of their face, their jaws, their head, their neck. And we should be supporting these surgeons more than like almost anyone else. I mean, you have heart surgeries, you have brain surgeries. That's not what I'm saying, but like, these people should be compensated so much more, exponentially more than other dentists, doctors, surgeons, and they're not right now in the system. That's a problem. It's very concerning to me, and this is something that it's very passionate to me because you have these talented people, these people that have sacrificed so much, and they can't live the life that they deserve because of the system that it is right now. Yeah, that's why I want to create a new insurance company that actually supports providers as well as patients, putting patients back at the center of healthcare. William, if you didn't match to OMFS, what is option 2, Doc? Well, there's two, A or B for option 2, right? If you don't match into oral surgery, either you go into a GPR or a non-CAT, or into private practice, absolutely. But generally, if you have a good CBSE and you don't know why you matched, I would recommend going to that non-CAT. If you don't have your CBSE yet, and that's why you didn't match, I would recommend going to GPR because you're going to have a lot more time to study for that exam in GPR, and you're not going to have a lot of time in a non-CAT residency. Does that make sense? Okay, that's very important. User 1222, how is dating life for people in OMFS residency? Scared I won't have the time to find someone as a single D. It's definitely, now I don't know. I'm in a relationship now. I got into a relationship my 4th year of dental school, and we've been together since. And it's very hard. It's very hard to find time. It's very hard for the person to understand the sacrifices you go, the time commitment. I'm fortunate enough where my girlfriend understands that, but not many do. Not many do. My girlfriend's mom was a dual degree doctor, a dual trained specialist doctor. So she kind of saw it growing up, right? So now she doesn't know because she didn't do it, but she understands a bit more than the average person out there in the populations. During residency, it can be very tough. It also depends on what residency you're going into. Are you going into oral surgery residency? It's tough. Try out Hinge. That's where I would start if I were you. The great kid said, "You're awesome. Thank you for everything." You got it, man. And thanks for your kindness. Autumn dental student. I'm in dental school with my friends and I split up making the Ankis. Saves so much time. That is an excellent thing to do. By splitting up, like you do one lecture, they do another lecture. You get 2 or 3 people on your study team. That is the best way to do it. And then you could go into these lectures prepared. You can listen during lecture and add anything that the lecturer mentions on the board in the presentation that isn't in the previous presentation prior to coming to the class. That's the best way to go. All right, friends. Thoughts on MUSC? It's the one in the dental. It's the one in state dental school for me. I don't know enough about it. I think it's pretty good. I don't know what their match rates are, their class size. I don't know enough about that dental school in South Carolina. All right, friends. I gotta get ready for March 10:30. Time to sign off. I love you guys. Guys, this is TikTok Live number 51. Thanks for signing in. The top 5 listeners to today, I'm giving you guys a shout out in the caption of the podcast on Spotify, Apple Music, on YouTube. I'll be giving you guys a shout out there. Okay, top 5. All right, friends. Thanks so much. And we will talk soon. Next week will be TikTok Live number 52. All right, friends. Adios. Good night. Have a great week.